Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? Have you ever wondered, what do surgeons do when they don't know what to do? They go to the more experienced surgeons that have been doing this for a long time. And today I am so excited about my guest. You guys are in for a treat. I have Dr. Russ Kridel on the show, and you guys are going to hear everything you need to know about revision rhinoplasty. Thank you for being on the show, Dr. Kridel. How are you?
Oh, I'm doing great, and a pleasure to be with you and with your audience today.
Thank you. We are so excited. We've talked about rhinoplasty on the show before, but this is the first time that we talk about revision. And I like to be very honest with my audience and tell them all of the ins and outs. They know that I always tell them, let's try to get it right the first time because working on it again might be a little bit more difficult. And one of those things that's always more difficult the second time around is rhinoplasty, right?
Yeah, absolutely correct. Absolutely correct. It's not the same. And sometimes patients don't understand the complexity of revision rhinoplasty, and they think it's just as simple as the original rhinoplasty. And even that's not that simple. But when there's been surgery on the nose before, it's a lot more difficult to get in to fix the problems that are there because there are no what we call tissue planes remaining. In other words, when you open a nose initially to do a rhinoplasty or go endonasally, everything separates very, very well between the cartilage and the skin and the bone. But when they've had surgery, it's almost like there's been glue put in there and those planes are stuck together. And you have to go very carefully through those to get to see what you need to do. And the other thing that's difficult about revision rhinoplasty is that most rhinoplasties are reductive. In other words, they make a nose smaller. That's the way most are. We can talk about making noses bigger too, but most of them are smaller. So what the surgeon has done before is to remove certain anatomic structures. And sometimes that surgeon may have removed a little too much. And so you've got to replace what was taken out with grafts. And so, well, where do you get those grafts? Well, sometimes you can get them from the septum. The septum is the partition between both sides of the nose. And in the front, there's cartilage in it. And then in the facial portion, there's bone. But hopefully, there's still some cartilage left in there. And you can use that for grafting material to replace what may have been inappropriately removed in excess before. And so that's part of the difficulty, is that we have to create structure out of grafts from the septum that look like grafts that were inside the nose before. So we have to do a little carving, et cetera, to do it. And that takes time. And so additionally, when we're doing revision rhinoplasty, we have to find out what the patient wants. And it may be that the surgeon didn't do anything wrong the first time, but there just wasn't good communication between the patient's goals and what the surgeon had in mind. And that's why we always do what's called computer imaging before we do rhinoplasty or revision rhinoplasty. And in other words, we take a picture of the patient, put it on the computer, and morph it. And then I try to draw what I think is reasonable to obtain based upon that patient's anatomy and what's been done before. And then the patient gets to say, well, I like that, or I don't like that, or can you modify it? And so we reach a common goal, good communication. And so sometimes, a patient will come in and the other doctor just didn't do enough or didn't do what the patient wanted. So the first thing we do with a revision rhinoplasty patient is to try to establish a goal. But here's where the patient has to understand that there can be a little bit more limited expectations in a revision rhinoplasty, because often we cannot do everything we want to do because of what was done before. So I try to draw on the computer a result that I feel very certain, or almost very certain, that I could obtain with the surgery, so I don't create expectations that I cannot produce for the patient. And so then I judge whether the patient is willing to accept this improvement. I always try and do better than what we draw on the computer, so that we can go beyond their expectations. But I like to bring them down to reality, because it is more difficult to do revision rhinoplasty. Sometimes, you can take twice as long to do a revision rhinoplasty as it does to do a primary or not done rhinoplasty yet. And so that's really, really important. And sometimes it depends upon the skill of the surgeon who was there before as to what I have to do. Sometimes there's only one or two things I have to correct, but I have been in cases where the previous surgeon perhaps did 13 things that were wrong or just weren't really right. And so I'm there a lot longer. Sometimes we have to build up the bridge again. Sometimes the nostrils are retracted up because they took too much cartilage out. I have to put rim grafts in. Or sometimes the surgeon didn't pay attention to the airway. God made noses for two reasons. Only one of them is to look good. The other one is to breathe through, So we've got to meld form with fashion, with appearance at the same time. But sometimes there are airway problems additionally. And before I even do the nose on the outside, the roof of the nose, I've got to go inside and correct the problems on the inside of the nose. Maybe it's the septum, maybe it's the turbinates that are causing breathing problems. But we've got to do both together in a revision rhinoplasty, so the patient can not only breathe, but also can look good.
I love it. I love to hear it. I know it takes an exceptional amount of skill to do what you do. And I want us to take us back a couple decades to the beginning of your career. And I'd love to hear how you decided to become a plastic surgeon and how you went into the path of facial plastic surgery.
Well, that's I think easy to go through for me. I think I understand why I became a facial plastic surgeon and why I liked to do what I do. I was sort of a nerd growing up, and really a big attention to detail. I put together all those little plastic airplanes and be sure all the decals went in the right spot and they were exactly correct and the painting was done. So I'm sort of the kind of guy who's like belt and suspenders and a little OCD, and it drives me crazy when I go in a room and there's a painting on the wall that's crooked. I want everything to be perfect. And that may drive my staff crazy. It may drive the people in the operating room crazy, but I think it's what the patients want.
And
is
they
someone
love
who
it.
really has attention to detail. So, I started out with that, I guess, early in my career, just being a good student and liking things like math or exact science where you always knew exactly what was right. So, and then I was very lucky. My mother was a very famous New York model many years ago. She's now passed away. And so I always appreciated beauty. And, a lot of her friends, et cetera, growing up, getting to know them. So I knew what was aesthetically pleasing. And then I was very lucky when I was in college. I went overseas and lived in Italy for 6 months. And while I was there, I studied art, especially Renaissance art. And that's when the whole look of perspective came out in art. It was a change from the Byzantine era of everything gold and flat to an area of perspective. And that's when people could really appreciate faces. And then, of course, Leonardo, even after the initial Renaissance, he developed the aesthetics, the proportions of a good looking face. And so I studied all of that. And so, gosh, then it was easy, to come back and combine my sort of nerdy OCD with my appreciation for art and beauty. And then it was really an easy step from there. And I always like to do things with my hands. So, all those melded together, and that's really how I started.
I love to hear it. I always hear from my surgeons that I interview that they love art, or they love the art of, they love art, and plastic surgery is artistry.
It is, you have to know the end point. If you're a surgeon, and you can take out an appendix, it's either in or it's out. Take out tonsils, they're in or they're out. But, when you do a rhinoplasty, there's no end point that says, here, cut here, and then you've done it. You have to know in your mind. You have to visualize what an aesthetic outcome is. You have to appreciate what good looks are. And it's different really for every person, because people have different facial structure. And someone may have a wide face, and then their nose should be a little wider, or they have a narrow face, and nose should be a little less so. And then you look at their proportions. And sometimes when you do nose surgery, you have to bring the chin out a little bit. So we look at that all together.
I love to hear that. So do you do a lot of rhinoplasty with maybe, is it chin implants, or are you doing actual like bone surgery?
Well, I don't do the actual bone movement there. And that's something you should do if your occlusion, if your bite is abnormal. But if your bite is normal, you don't have to go through cutting bone. That's quite a bit to recover from. And so you can just put a chin implant in and bring out the chin if it's retrusive. And so just did that just the other day, and I've got one, I think, in another 2 weeks where we're doing that. But those are adjuncts to the rhinoplasty and to the revision rhinoplasty.
To balance, right? That I think that's
right.
what
Balance.
Facial balancing, where you're looking at the whole face and you're not just doing one thing, but you're making it all harmonious.
Yeah, and it's the same thing too with the sides of the nose. Some people have wide noses, and we actually make little incisions and bring the sides in too. So there are all sorts of different proportions of the aesthetic face that we take into consideration.
Absolutely. So one of the questions that I hear, or I'm going to say one of the things that I hear quite often is, I got botched, or my nose got botched. And one of the questions that I have is it really botched, or is it just bad healing?
Well, I think most surgeons try not to leave the operating room unless everything is the way they want it to be, based upon their skill. Now, they may just not have the skill or the appreciation of the right aesthetics, but if they do, we all have to rely on healing. And that's why I feel that post-operative care is very important. We see our patients very, very often after surgery, because sometimes one side may be a little bit more swollen than the other, and we can inject a little medicine such as a steroid to control that. And so that's very important. And our post-op care, we include a year's post-op care as part of the surgical fee. And so it's very, very important to do that. All noses sort of look good right away, but sometimes then when the swelling goes down, you could see a little asymmetry here and there, and you've got to take care of that and know about that. So post-op care, you should be seen, of course, usually the day after surgery, a week later, a few weeks later, then a month, 3 months, and then we see them 6 months and a year too. So we follow our patients quite carefully.
As much as they want to see you, right?
Important. As much as they want to see us.
Yeah. Exactly. So on this show, I'm always preaching to my girls, my listeners, my audience, they're my girls. I'm always preaching to them, post-op care after your plastic surgery could make or break your result. If you're not following up with your surgeon when they're asking you to, for example, if you're traveling for surgery, I would feel more comfortable traveling for a tummy tuck than traveling for a rhinoplasty, just because of the follow-up care and that post-op period. I would really want to be able to see my surgeon and have them. A tummy tuck, we can hide that scar. We can hide, some imperfections under clothes. But when it comes to your face and it comes to your nose, we can't hide it. We can
That's right.
we can try with makeup, we can, highlight it, make it look a little different, but ultimately you can't hide your nose. And that is why I feel it's really important to make sure that the surgeon that you're going to for a procedure like a rhinoplasty, they're going to hit it out of the park. So that's you, Dr. Kridel. I know you're known as the doctor's doctor, the surgeon that other surgeons go to when they have questions and they need a little bit more. I'm sure that fills you with so much pride.
Well, it does. It's really a delightful compliment to me when surgeons come in, they bring their families in for me to do the surgery on their families. And so, yeah, yes, it is. But follow-up care really is important, and when we have patients who are from out of town, we try to get them to say that they're going to stay in town for 10 to 14 days afterward. And then I've trained a number of fellows, people, doctors who spend an extra year after their residency just want to do facial plastic, usually with a concentration on rhinoplasty. They spend a year with me, but they're all over the country. So it's like my troops are out there. And if a patient is from LA, I can send, one of my patients post-op to see them. And I know that they're going to get a good follow-up there. But we also do Zoom, and patients, if it's hard for them to come back, if they're in some small town out in the middle of Montana or something like that, we can follow them that way and then say, hey, well, you're doing great now, or you should come in, another week or 2 months. So that is so helpful now, is to have that capability that we didn't used to have before.
Absolutely. One of the things that I like to talk to my girls about is that when they are going in for a consultation, they're interviewing the surgeon. But what they don't realize is that sometimes the surgeon is interviewing them too.
Well, that's so true. That is true. Well, we have to be sure that we communicate well. That's the most important thing, and the patient has realistic expectations. And because, the whole goal is to make the patient happy. And I have to know that I can make that patient happy. And it has to do not only with their attitude, as well as the physical findings that are there. And so it's so important that all the people out there try to feel comfortable with their surgeon and know that surgeon's looking out for their good health and will do everything he or she can to achieve that goal. So you gotta, I have to like the patient and the patient has to like me. And if not, we shouldn't be operating on them.
Exactly. It has to be a good combination. I tell my girls, when you're choosing your surgeon, you need to take that decision as seriously as when you're getting married, because you're putting your trust in this person, and you have to. I've talked about this previously, how when you trust your surgeon and they tell you it's normal swelling, you accept that it's normal swelling and you calm down and you go through the process. But if you do not trust your surgeon and they're telling you it's normal swelling, you're not going to believe them and you're going to think something's wrong, and it's something
That's
else.
Right. That's right. Well, that's one reason that the post-op care is important, is to go over that with the patient and reiterate that. 80% of the swelling goes out within 3 months, but in most noses, it takes a good year for all of it. And I actually have some sequential pictures of patients to show them. Say, see this patient now, look at them. They look good at, a month. They look even better at 3 months, but look at them in a year, because that's where the final result's going to be.
I would love to get that photo, a sequence of those photos, so we can use it during this recording, during this video, and we can show the transgression of the swelling going down and how the nose improves over time.
Yeah.
Tell me, what are some trends that you're liking, and what are some trends that you're thinking this needs to go away?
Well, you mean surgical trends or outcome?
Surgical trends that are procedures that people are coming in and requesting that you're like, what is this?
Okay. Oh, I understand. Well, as far as the nose is concerned, I've been around for a while, so I've seen where all of a sudden one trend will come up and be the biggest thing, and then all of a sudden it'll become unimportant and come down, and then it'll have a rebirth later on. And so I think that patients shouldn't look for the doctor with the latest trend necessarily. They should look for the doctor with the best results. And I think looking at before and afters of what the doctor has done is very key, so you can appreciate the aesthetics that he or she has. Right now, there's a trend of something called preservation rhinoplasty. And
I've
it's
heard.
not as if we haven't been preserving structures in the nose for years and years. Everything I do is I try to preserve those natural structures, but it's sort of a marketing tool now. I do preservation rhinoplasty. And so it's sort of a joke. But what they're doing is they're doing an old procedure that was over 50 years old, that was started out in the Midwest in Kansas, and then made it down to Europe and Mexico. And now it's having a rebirth. And this is where they don't sand down the nose. They don't take it down. They go underneath of it and remove tissue and push the nose in. And they call that preservation. But in some cases, it's more complex than doing a routine rhinoplasty. And those who have skill with the traditional method can make it a lot easier for the patients, I believe. And there's a big learning curve in that. But there are some courses now on so-called preservation rhinoplasty. But I've developed some tips on some techniques on the tip of the nose to work on that. And what I've pointed out, and I've written papers on this since the 1990s, and for a long, long time, about how to preserve the tip cartilage. So I've been, as I say, been doing it for years.
Trailblazing.
Yeah, but anyway, so I think it's always amusing to me to see how all of a sudden one technique will come up and down. And what's most important is whatever technique your surgeon uses, is it a good one? Does it produce good results in his or her hands? Because it's the hands of the surgeon that are important, along with the judgment. And there's a Japanese philosopher who said, there are many ways up the mountain, but the view of the moon and the stars is always the same once you get to the top. So surgeons will have different techniques, but do they get the result that the patient wants and the doctor wants? That's what's important.
Absolutely. On my end, one of the trends that I'm seeing that I'm like, I think this should go away, is these little tiny, very lifted noses that are coming from overseas. I'm sure you've seen them.
Yeah, well, those were big also back in the 1950s. That sort of upturned little bob nose that was big in New York. Way before I was ever doing this kind of stuff or bored. I mean, so there was a trend of that, the tiny little noses, and then with the years and feminism coming in and playing a big role, women went away from that tiny little bobbed up ski jump nose to a stronger nose, as they were accepting, bigger jobs and being in the workforce and just, equating the lift of feminism, and so that sort of went away. Now, maybe, I don't know where you're located,
I'm in
Mavi, but
Houston.
you're in Houston. Oh, you're right here, right
Yeah.
where I am. Okay, great. Well, I've not seen it that much here, but I know that some of my colleagues in LA have started to see that again. But you gotta, when you're doing the rhinoplasty, it's for the patient's life. It's not like a hairstyle you can change and then you don't like it, my hair will grow out. Well, once you do the rhinoplasty, hopefully you do it well, it's there for the rest of their lives. So you got to be sure that they're going to, as they grow old, they're going to like that nose, to continue to like that nose. So, that's what the computer imaging is for. And if somebody comes into my office and wants something that doesn't fit within those normal parameters, and, then I'll say, gosh, I don't think I can make you happy because I'm not going to do that for you. I have to put a
Absolutely.
little judgment in to help the patient, because sometimes trends are short-lived.
Exactly. I like to tell my girls, your face is not a trend. Your body is not a trend. We don't want to keep up with the trends. You want to be authentically yourself, just an improved version of yourself, but keep your identity. You don't want to look like everybody else. You don't want to have the same face, the same nose, the same
No,
jawline. You lose your uniqueness.
that's right. And the same thing is, I mean, if patients will go in the doctor's office and look at the post-op results, hopefully all the noses don't look the same.
Exactly.
They should be individualized to every patient because different patients want a different look. And as long as it's within, that pie shape of normal parameters, aesthetics, then it's fine to do that. But you don't want to do cookie cutter noses. That just doesn't
Absolutely.
work. Yeah, no cookbook rhinoplasties.
Absolutely. We don't want to see identical noses on a full before and after gallery where every single nose looks the same. That I don't think that's a win. I agree with you.
Yeah.
So one of the questions I have for you is if someone is unhappy with their nose job, let's say they've just had a rhinoplasty 5 months ago, when should they consider a revision versus waiting it out?
Well, we like to say about a year. Now, we modify that depending upon the individual circumstances and what's going on. I mean, if there's an infection going on, we've got to go in right away. If there's scar taking place, we can do some injections and see how it does. But if it's getting worse, we may want to go in sooner. But as we mentioned, it takes a while for swelling to go out of the nose, from whether the nose was botched or not. And so sometimes you have to wait till the body does the most healing that it's going to do. So you're down to where it's going to stay. So then you know what to modify. But you could go in too soon if there's a lot of swelling and take a lot of tissue away. And then when your swelling goes away from that revision, maybe you've done too much. So each case you have to just evaluate and see what's gone on. Now, I just saw a patient today who'd had previous internal nose surgery, and that patient had what we call a septal perforation, or a hole in the septum where the doctor went in and caused some tears and a hole in there, and that would be a revision, but the patient is having some bleeding and crusting, and he only had a surgery a few months ago, but it's okay for me to go in on that patient now because he's having lots of symptoms. And so we're going to book his surgery for another month or so. And that's not a year. So that's an exception.
Case by case, right?
Case by case.
That I love that. So I have a little cheat sheet of questions I wanted to make sure I asked you.
Great.
What is, for our listeners who maybe they're just thinking about a rhinoplasty, they don't really like their nose and they're considering it, but they've never really deep dove into it. What would a person who's considering a rhinoplasty expect in that process? Like, what does the normal rhinoplasty process look like as far as before, during, and after their surgery?
Okay. Well, the patient first has to give themselves permission to have their nose surgery, and they have to do it for themselves, not for a mother, a father, a loved one, whatever. Not to please anyone else. So it's got to come from their heart, something they've thought about for a while, and it's good to hear from them why they want to have it done, to see if it's what it is that bothers them about it, and how we can work to improve that. And sometimes it's just a self-image thing that they feel that it detracts or brings attention to their nose and not the rest of their face, and it's just too big, or for ladies that they got their father's nose, with a big bump on it or something like that, or their ethnic noses too, of people who have droopy noses, more the Mediterranean type of noses. And They don't like that Mediterranean droopy nose look. So we try to figure out what it is that the patient doesn't want. We bring them into the office and we take their pictures, and then I will do an exam on them to see if they are having any kind of airway problem at the same time. Because if you take a large nose and make it smaller, the breathing passage usually gets smaller too. So we have to be sure there's no pre-existing airway obstruction by a deviated septum or a nasal valve collapse or large inferior turbinates due to allergy or other causes. So we do the exam, and I ask the patient, give the patient a mirror and say, what is it you'd like us to improve? And then once I hear that, then I go to the computer imaging and try and do a drawing based upon what the patient says that they want and what my exam tells me I might be able to do. And then my patient coordinator then will spend time with the patient, showing them before and afters, because the computer imaging is just a drawing. You could draw anything, but that doesn't mean you could obtain that. So we want to show the patient, a sort of a gallery of before and afters of noses that I've operated on. And then at the same time, while I'm working on the image, the patient coordinator will go over, what's pre-op care, post-op care, et cetera. And that's how we do it. And then patient comes into the imager, we look at it, and then they give us their 2 cents. Well, could you take a little bit more off there? Or can you make that tip a little more narrow here? Or can you do X, Y, and Z? And so then that's when there's a good interplay of communication. And then, and I say, well, yeah, I think we could do that. But it's not just because I can draw it, but it's because I can achieve it. Or I'll say, you've got really, really thick skin. We don't change the skin with the rhinoplasty. We change the structures underneath. And I can get you a little bit more definition, but maybe not as much as you want. Is that okay? And so we come to an understanding then of what the limitations are, because everybody doesn't have the same skin structure and et cetera.
Absolutely.
And then the patient spends more time with the patient coordinator. They'll pick a date, and then they'll come in usually a couple weeks before surgery and do what we call a preoperative visit. That's when they sign all the permits. We go over the pictures again if they want. That's when we tell them what medicines they can take before and they can't take before surgery, and then we give them prescriptions. We like them to fill the prescriptions prior, so they don't have to. Someone doesn't have to run to the pharmacy the day of their surgery, so they have those with them post-operatively, and then we take the final pictures of them, the pre-op pictures, then see them in surgery, and then we see our patients the next day, because we do put a very small amount of packing in the nose, not big packing, but just a little bit. So they don't have any bleeding. We take that out the next day, and then we give them further post-op instructions, and we give them sheets of post-op instructions anyway before surgery that they can read. And then they usually have a splint on the outside of the nose, and that stays on for about 5 to 7 days, depending upon whether the nose was crooked before surgery or not, how long we want it to last. And then we bring them in at that 5 to 7 day period, and we take the splint off. They usually have some little incision here. We take the stitches out. We retape it for about 3 to 4 more days, and then they come back in then. And then that's like 10 days. And then it all depends upon what we did and when we need to see them again. We might see them again like 2 or 3 weeks. Usually that's what we do. And then after we see them after about a month, then about 3 months, 6 months, and then a year. So that's what we usually do. Now, it also depends if we've made the little incisions on the side. Those stitches may come out a little sooner or later. So that's pretty typical of what we do. Patients have to be very careful with their nose after surgery. They can't go play volleyball or something in the postoperative period. They can't get their nose hit. They can't strain too much. So there's a little limitation on postoperative activity. And then usually after about 4 to 6 weeks, they're good to go and they can forget they've had their nose done other than looking in the mirror.
Only when they look in the mirror and they're like, I look so good.
Yeah.
So tell me, how is that moment when you are removing the cast and they're looking at their nose for the first time?
Oh, it is just the most wonderful feeling. I get to see how happy the patients are. It really is. And then we have one of these mirrors that tilts in, so they can get in front, and then we can show them their profile. And I usually show them their pre-op right next to it, and they can say, "Oh my gosh, look at that! Look at that!"
I
Yeah,
love it.
yeah. It's such a joy. I'm very lucky to be in a profession, a part of a profession, medicine, where I can make people happy all the time. I don't have to tell them they've got heart disease or they got diabetes or anything like that. I can just say, "Hey, I can make you happier." So that makes me happy.
Absolutely. It's we on the show, we always talk about that post-op glow up and
Yeah.
just that confidence that patients feel when they look better in the mirror and they feel better about themselves,
Oh,
and it just catapults them into new jobs,
it,
different things.
that's so true. It's sort of an upward spiral afterward, and they just love it. And it's, for the really young people, that makes them feel more accepted in their peer groups, and the others, it just gives them confidence that they didn't have before. And we find that
Absolutely.
patients all of a sudden start they're coming in, their attention to their hair and then makeup all changes, and it's a big spiral upward.
It's the glow up. I call it.
Blow up. I like that.
They're like butterflies, and that time that they're in the bandages, they're like in their little cocoon,
Mhm.
and then the bandages come out, and the butterfly comes out, and they're ready to take off.
I love it. Yeah, that's great.
So, Dr. Kridel, before I let you go, I want you to tell my listeners, I want you to pretend you're talking to your mom, your sister, your best friend, your wife, and they're thinking about having a rhinoplasty. What would you give them as a piece of advice as they go on into their journey of finding a surgeon and going through the process?
Well, finding a surgeon is an interesting uh, task, and it should be done very, very carefully. Because, as we say, I started talking about revision rhinoplasty, and you don't want to have a revision on your nose, because it's more complex. Then you have to pay twice. You have to pay again to get it fixed. You've already paid it once. So the choice of the surgeon, I think, is very, very important. I tell them to pick someone who's got some experience under his or her belt. I think noses that doctors do in the first few years of their practice probably aren't as good as the ones they do in their next 10 years or so of their practice, because you learn the different nuances and how things heal. So experience is very important. We already talked about communication. Be sure that you like your surgeon and you think your surgeon cares about you, and you're just not a number, or you're just not an operation, but you're a person. Be sure they're listening to what goals you want to achieve with it. It's good also if you as I mentioned before, your nose has to breathe well. And if you have a breathing problem, or you don't want to have a breathing problem, I think it's good in nose surgery to pick someone who has experience in the airway as well, like in the ENT. I've got my boards in ENT, or otolaryngology is a fancy word, as well as in facial plastic. And so I think the two of those, that combination is important. Be sure you like their before and after pictures, and not just the image that they do. Um, and what else makes them stand out? I mean, I have over 200 publications in peer-reviewed journals, which shows that my colleagues think I have something to say and teach. I also teach fellows, and so the universities wouldn't send their residents to me to teach them unless they thought I was doing a good job. And so these are important extra little things that you need they need to look at in choosing the surgeon. Uh, I think that's key. They have to understand that the more qualified or the more experienced surgeon probably is going to cost more than the guy who's just out the first year in practice, who probably wants to have more patients and et cetera. But that doesn't, don't get cheap when it's your face. Like you say, it shows. And it's better to have someone cost a little more and do it once right than have to go in and get revisions afterward. I think that's important also.
Absolutely. If one of my listeners, one of my girls today wants to come see you, how could they find you?
Oh, well, they can call us. 713-526-5665. That's 713-526-5665. They can talk to one of my patient coordinators, either Karen Butcher or Ashley Vanache. So either one, Karen or Ashley, would be just fine. And
Wonderful.
we would look forward to having them come in.
Wonderful. So, ladies, if you're thinking about having a rhinoplasty, you heard it here first. You have to really vet your surgeon before you go under the knife and make sure that they're not just going to do a really good job, but that they're really interested in your overall care and that they care about you and your outcome. And with that, you guys, I will see y'all next week. Thank you so much for being on the show, Dr. Kridel. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.